executive finance company, you're talking about 9%. If you want to pay over 10 years, you're talking about 9.75% if you want to pay over 25 years. Okay? And they're saying, look, all these things are possible. They are very, very possible. There are no hidden charges. They're not going to suddenly hit you with something that nobody had told you about. They're telling you that if you make a payment in advance, it is suddenly not going to cost you money. There are no penalties for having this payment made in advance. I mean, you know, the list of the things that are beneficial to you just go on and on and on and on and on. Now, if you're one of these people who has problems with believing things that you're told, let me just say this. It is not a bad thing to be someone who doubts, but why don't we just ensure that your doubts are put to rest? And it's simple. How you can do this is either visit any Diamond Trust outlet, any branch, or simply email mortgages@dtbafrica.com. That's it.
Perfect. Okay. So now, Max, you know when I travel, and like now when I'm away and you want to send me money.
I want to send you money.
Yeah, I'm being prescriptive here.
You know I'm the new one.
You don't worry.
You have to give me reasons. But Valentine's is coming.
Don't worry. Why are you?
Yes, I want to send you money.
Thanks. You see, I knew we would get there eventually. Yeah. Now, it doesn't have to be painful for you. You see, already the process of you sending me the money is giving you this great joy, right? So we must continue the tradition so that you don't feel any kind of pain as you're finishing the thing.
Today across borders. So
now, what we want you to do is want you to use the Virtual FX platform, okay? And you don't have to worry about, oh, I'm sending into this money. Will she get it tomorrow? Because tomorrow is not business that we talk about. It's the day of sending money. It has to be to
now.
Thanks to now. We're not talking about tomorrow. We're not talking about delays, or maybe you get it, maybe you not get it. How are we going to change money from Kenya shillings to, pounds, to those things they use in Kuwait are called what? Those ones. How are we going to make sure? So now, Virtual is saying you don't have to worry about those things. Money you send, I have it. You want to change to currency? It's done. You want to say, oh, they'll charge you high? No, they won't. Low fees, there are no hidden charges, nothing like wasting time, nothing like saying we can't change it in currency, not saying that your friend now will be disappointed because in 3 minutes she didn't get the... Nothing like that will happen. So you see, this joy that you have in sending me the money, we prolong the joy with all the things that the platform comes with that will allow you to send this money. Now, in case the things I have told you, you're not understanding them completely, there's a website, www.virtualfx.com. Find out all that information, and now, so that by the time I'm going, you have all the information that you need, and we're not going to have to do this again.
And because I want you to be happy in your travels.
You see?
Exactly.
You're a good man. That's why we like the things like this, and you see, just like that, we are done. We're finished. We're gone. And those are the conversations that we have every morning here in the Situation Room. Our guest for this hour is seated, and we'll be talking about something that we talk about all the time, but at the current global discussions, it's very important to have. Our guest is Professor Elijah Songok, and he's the Acting Director General at KEMRI. Good morning, Daktari.
Good morning.
How are you?
Fine, is it?
You're very tall.
I don't know. He's not very tall. He's extremely tall.
I
was distracted for a moment.
You were seeing me when coming to your door. I said that this person is
what did we do?
You need to increase the door size.
Ndu is designing her designer baby. I think she's just the prototype.
That's interesting.
Karibu sana to the hot seat of the Situation Room this morning.
Okay.
We're looking at a big issue, the role of KEMRI and organizations, institutions in research. A big ticket item that we discuss in this room as well as in the country and around the world right now. So we're very glad to have you in the room as we talk about that today.
Thank you.
But let's welcome you in true Situation Room style. CT goes to a different African country every week, and he comes back with proverbs that he shares with us every day. So he's going to tell us what the proverb is, and we'd like you to tell us how you would translate that and how it would resonate with you. Is that all right?
Okay.
Okay.
I'll try.
Okay.
Well, I have the privilege of actually hosting my director. I have been associated with the Kenya Medical Research Institute for a very long time.
Yeah, you look very familiar. I think you are one of us.
Yeah.
Yes. Yeah, when I walk in there, I say, this gentleman seems to be. One of my
in the
staff.
wool.
Yes, that is absolutely correct. And it is our pleasure to have you here, Director General. It's our pleasure indeed. And thank you for making the time. Our proverbs for this week come from the Republic of Djibouti. A guest who breaks the plate of his hosts is not soon forgotten.
I guess who breaks?
The plate of his hosts
Yes.
is not soon forgotten.
That is an interesting. Yeah, it means that you have to show yourself. I mean, when you break the plates, breaking a plate means that that is
No.
tough one.
Keep it simple. You are a research scientist, and research scientists are going to now go into details.
Yeah,
What is the color of the plate?
No.
What was the density?
What was the plate made of?
Yes.
Okay? And I'm sure it was a plate and not a
Yes.
bowl. No. Let's not go there. Let's just keep it simple. It's a plate that has been broken.
Broken.
Yes. And you're a guest.
yes.
Why is it that your hosts don't forget you when you've broken their plate?
They don't forget you because no, I can't get it.
Oh, no, you've got it actually. Now, this is what happens when you have a research scientist in the room.
He wants to collect data.
He's actually asking, I don't have sufficient
How
data.
many data points have I been given?
I cannot give an informed opinion on this particular
In fact, was there a control plate?
First
So
of
then
all,
maybe what we can do is we can introduce some research questions that could bring you to the answer.
Yeah.
Do you feel any kind
You
of
have to tell
pledge?
me what is the hypothesis of
Would you imagine?
Then I could design a study around
Design a study around the breaking of plates in Kenya.
Collect data around those breaking of those plates.
Yeah. So, Prof, maybe I could ask you this way. Would you imagine that if you owned a plate and it was broken by somebody who came into your home, that you would be happy?
No.
You would feel some kind of displeasure, wouldn't you?
Yes, you feel like actually you feel a little bit.
So when you remember the loss of that plate,
Yeah.
what do you think of when you think of that plate and that it no longer exists in your collection?
You see, that's a prized possession. If you had a plate, that is something which is prized. And when somebody comes and really breaks it, I mean, he has taken something which is dear to you.
Yes.
So I would say that the person has will you say spite you?
yes.
The person has spite you.
Exactly.
Yes.
There you go.
Was it?
We just needed to give him more data points.
You clearly needed more data.
Thank you, Dad.
Create a graph of best fit.
In fact,
He has no respect for you. Yes.
what you just did, you brought in the element of research ethics. Yes. And the moment you talked about owning something precious, now.
Now, yes.
Became clear.
Yes.
But you are 100% right. When guests come to a home, we take out the best we have. And if one of those things is destroyed, the person who destroyed it, we don't forget that person in a hurry.
Not in a hurry.
Yes.
Yeah.
They are remembered for every time you miss that thing, you say, but there was so and so who came here. It's them who actually broke it.
Yeah.
Yes.
Indeed.
Yes.
And I guess that sets the premise for the conversation that we'll be having this morning, Professor Songok. And when we talk about Kenya Medical Research Institute, which is KEMRI, we say KEMRI all the time, and we fail to remember that it actually is a research institute, when we do discuss. But then when we talk about the importance of research, just give us an overview of some of the kind of research that KEMRI has been involved in over the years before we start to look at the pointed importance of that.
Okay. Thank you. Thank you, Udu. The KEMRI has been in existence for the last 45 years. And it was formed specifically with several mandates. And the mandate mostly is research. It's research for human health.
Yeah.
To advise the Ministry of Health on matters of policy on health. To capacity build on research. To do partnerships with the like-minded organizations, both locally and internationally. To do incubations of products, which has come out of research. This we have been doing for, as I say, the last 45 years. And when you come to where we are based, we are, apart from Nairobi, where our headquarters is, we have actually 15 centers across the country which are doing this research. All the way from Kilifi, Nairobi, we have a center in Busia, Kisumu, Kericho, Mandera, Taveta, Malindi, Mtwapa. The other day we formed 2 new ones, and that is Kirinyaga and Eldoret. So these are the particular areas that we carry out our research. And our research teams are very broad. Number one is we look at the area of priority, the disease of priority in this country. Not only within this country, but also the region. Number one has been infectious and parasitic diseases. These have been the top ones. When you talk of infectious diseases, we are talking about TB, we are talking about malaria, we are talking about HIV. We are talking on new emerging infections. Like now, talk about Ebola, talk about Marburg, talk about Mpox. So that is a line of what we call infectious and parasitic diseases.
Okay.
The next line that we work on is on biotechnology. This biotechnology is the products. The moment we do our research, we have products coming out of this research, and we develop those products. And those products include diagnostic kits, it includes vaccines, it includes drugs. So those are the biotechnology part, where we can be able to get those particular output from the research. The other area which we are very strong also is the area of traditional medicines. We have been working very well for the last 40 years on the areas of traditional medicines, seeing what our local alternative medicines can be able to offer in terms of treating these particular infections. We have the area of non-communicable diseases, cancers, hypertension, diabetes is also one area that we are really working on. We have child's that is sexual transmitted infections. We have child health. We have reproductive health. These are also very key ones that we also work on. We have public health, and what is called public health systems. It's also another area that we are really working on. So it's a big, broad areas, but mostly it is towards the sections that are of public health importance in this country.
As you look over the years, and one of the things that you mentioned, which caught my attention, is that you then serve as an advisory to government in terms of the things that they should, take up, decisions that they should make, whether these are decisions of a financial nature or decisions of a public health nature, advising the Ministry of Health, for example, over certain things that they must do. So then the question would be, over time, in a range, how would you say that the absorption of government, of ministry, of the information and data that you've been able to collect and research on then has been? How well has that absorption taken place over time?
We could say that it has been, the absorption has been going on. First of all, when we do research, when we get the output, we do it what is called a policy paper. And in that particular policy paper, we now inform the ministry that this is the particular direction you should be able to go. Let's say now changing our treatment. Imagine the areas of malaria, because you have been using chloroquine, and we find that the research that we have done is finding that chloroquine resistant. We inform the ministry that right now we can be able to have to change this. Then a policy comes out for the change of that. The ministry has been taking it. It has been taking majority of the particular suggestions you have made in Kenya. The other one is that we sit in expert committees within the ministry. And within that, we can be able to guide to our expertise that this is a direction from the data that we have, from the research that we have, that we should be able to go as a country. So I could say that the ministry has actually been taking it because we are part and parcel of the ministry. Yes.
You know, many Kenyans are worried, and you do a wonderful job, of course. And how we know you do a wonderful job is we are all not dying of measles and mpox and things like that, meaning that KEMRI is doing a good job. There's the question now in terms of the funding coming from the United States of America, which is on every person's lips. Do you feel that you can absorb that shock? And if you can also tell us what amount of cash or capacity will be taken away should the Americans actually pull through with their defunding of WHO and other USAID programs?
Yeah, Bichache, I think that is a risk. That is a great risk that we have been working on. First of all, in KEMRI, for us to do research, we have to get funding. And this funding is usually in terms of grants which our scientists apply. When our scientists apply for this, they apply with other partners. And then we can also have partners who directly come to KEMRI with their own funding and work with us. 50% of the funds that we get in KEMRI is from the American government, the federal
50%.
government. Yeah, 50%. This is, they come to agencies like NIH, National Institutes of Health. They come to agencies like USAID, agencies like CDC, and agencies like DOD, the Department of Defense. There's a big risk. When President Trump came the other day and said there's no more foreign aid, we actually are impacted. And the other day we had to see how we could be able to manage this risk. We have the stop order that came in. We have actually we have laid out staff for 3 months. The ones who are funded by these particular agencies, especially USAID and CDC. As we await the next way out of that. As you said, it's a risk. And we have been trying to find out how we can be able to really manage that risk as way of going forward. One way we are really proposing to the government is that there's a need for the government to own the research in this country. There's a need for the government to be able to fund research, because also when we do get this particular funding from our side, sometimes the priorities are not ours. The priorities are set up there. So that's what we always say, that he who calls the piper, he plays the tune, plays the piper.
Yes.
So the moment we manage to get our own funding, we shall not be really have what we are experiencing in terms of the issue of Trump cutting up our funding.
Right.
That's number one. Number two is try to use our own resources that we have in KEMRI, as we are trying to do, to be able to raise our own funding. We have the products that we have made. That is diagnostic kits, which we are really pressing on the government to be able to purchase. The moment they purchase that to KEMSA, we shall be able to get funding to continue with our work without having to depend on the external donors. That is what we think may be best way forward, because as we continue really depending on this external funding, we shall really be facing a similar thing of laying out our staff or not looking at the issues or priority of this country. I think the worst part has actually come in the terms of treatment and then the PEPFAR part. Yeah. Even though it has been designed, I think theirs is the one which really been hitting us so hard.
From a research point of view, Prof, because, I mean, we've been to Kilifi. We've been here to Nairobi, KEMRI here in Nairobi, and seen. I mean, because the stuff that is happening at KEMRI it's groundbreaking stuff. We may not be able to actually appreciate the levels to which KEMRI is actually doing some groundbreaking stuff here.
Thank you.
Now, when it's and this has been largely, I mean, by your own admission, funded by external bodies, largely. But there's an opportunity, in my opinion, to have that backed by the Kenyan government and looking at ways in which it can also bring its own like-minded partners. There's something else you said, that, of course, he who pays the piper calls the tune. That means that if I'm giving you money, you're likely to do research in and around the areas that I would want you to do. We had a conversation here with somebody from KEMRI a couple of weeks ago where it was clear to us that, okay, well, if we apply the much needed backing of funding towards certain things, then for example, some of the medication that we get on this side of the pond, which may not necessarily be for us as Africans, we could actually start to produce them, research about them, and have them done here for Africa, for Africans. Should that not be now what our focus should be, to say, can we now start to look towards solutions using this research that will sort out some of these diseases that are inherently ours, quote unquote, or some that we've inherited over time, the non-communicables that we see, the HIV now that we have such a huge burden to be able to deal with when it comes to treatment? Isn't it time to set the clock and have government actually see it from that point of view?
Udu, I think, as you said, it is actually an opportunity. It is a very good opportunity for us to be able to reset, as you say, the clock. One thing that we actually saw, imagine during the COVID time, which was also a big opportunity for us, when we realized that we have been depending on others, and then COVID just came in like that. And we had to really look around and see what are the potentials that we have as a country to be able to manage this. Yes, it is an opportunity because when there is a need, you have to be able to to innovate. Yes, the government is realizing that, and actually several days ago, one thing that we actually said is that first thing will be staff, because as you see right now, things is that we are laying our staff. These are particular people who are really doing the great job. All those particular innovations, as you are saying. All these particular new breakthroughs in terms of research. These publications is because of this stuff. So one thing is, we need first of all to be able to be able to have our staff actually owned by us. I mean, employed by us.
Yes.
Yeah, because they will not be singing somebody's tune if we are the ones who are actually paying them. So I think we are having the government listening to that. And we're happy that having seen those risks that we have been facing, we are going towards an area right now that we will be able to have, even though with the particular limited resources to this country, I think the government has really seen that this is very critical. Research is critical. And it's not only critical, in that there's a need for ownership. And ownership means us we have to be able to really invest in the particular people who are doing this research. So yes, this has created an opportunity. And also as that, one of the things you could always say is that when we have been doing these researches also, is that there have been areas that we are really thinking are our own, or the ones which are we ourselves think is our priority for ourselves. And these are the area of traditional medicines. Let me tell you, the area of herbal medicines, we rarely get funding from outside because of that. The funding that we get usually has to come from within. Because we work with the funders outside do not see how they can benefit from our traditional medicines. So this is an area that we are really pushing, especially for local support and local funding. And also we are asking Kenyans to do that. You see, now cancer is a major problem in this country. And KEMRI, we are trying to be able to get solutions towards the cancer menace we have. And due to lack of funding, we cannot be able really to be able, or limited funding, to be able to push the particular traditional medicines that we think are really working towards products and to be used in the mainstream, or to use by in the hospitals, or to use by prescribed by doctors. This is because if we could be able to have research on this, funds to be able to do research on this one, that would be better. So that we can be able to look at those particular alternative medicines which have been seen to be working against cancer. We are going out soon to be able to ask Kenyans that if you have been affected by this, we will be needing you to be able to support us in terms of even donations to us. It's a foundation. So that we can be able to look at the priorities that are affecting us in this particular country. So that we don't need to be able to look at the outside. So there is also the need that we ourselves have to look at, is research good for us? Is it bring out the innovations that would be able to support us? Are we exploiting the particular resources that we have that can be best for us in terms of health? If that is it, then afterwards you will be able to getting out and say, please say how you could be able to support us in terms of funding. Yeah.
My follow-up question, you said the United States contributes 50% and staff already being laid off for 3 months. Of the other 50% that is left, how much of it is being funded by the national government? I'm quite curious.
The national government gives us a budget of 10 billion that we have. We have 3 billion for national government.
3 billion.
Yeah, that 3 billion mostly is for staff. It's for staff.
Yeah. So the research is, by and large, our research is foreign funded.
It is not, I could not say 100% foreign funded. Because it is our own staff that
no, I'm saying by and large. So
yes.
So the government gives in 30%,
yes,
but 70% is foreign, and 50% of that
is from the US.
Is from the United
Yes.
States. Okay, I just need that.
Perhaps I can explain this to you. You see, the way research works, when you hear those percentages, it's not an absolute figure in the mathematical sense of the word. Research seeks to answer questions, and when somebody funds research, they have been convinced that you are in a position to help them answer the question that they wish to answer. And people who fund research don't just fund Kenya. They'll probably fund other countries within the continent and in other continents.
Yes.
And the reason is very simple. If you want to understand, say, a disease, you can't just understand its and the presence in your own country. The West, especially America, understood this a long time ago.
Yes.
So they want to understand the ramifications of it elsewhere because they want to understand how it will bear meaning in their own country.
And how to stop it from coming
into their own
country.
Yes.
And that's the question I was heading to. If it's funded 70%, where does the intellectual property belong to?
Can we take a break and then we'll come back and answer that question? Let's do that. Please remember what that question is, Mark, because I know sometimes when you hear music or something else, you tend to fly out the window. But I think it's a vital point. Professor Elijah Songok, who is the acting director of the Kenya Medical Research Institute, is our guest this hour, and we're looking at really how KEMRI has been involved in research, health research around the country, and we're looking at so what does the future look like with all the global bumps that we are seeing at the moment. We continue after taking a look at weather and traffic. We'll be back after this.
To get into this breakthrough.
Yes.
But when we needed the medication, it was as if we did not participate. So the issue of intellectual property and owning what it is exactly we research in this country, how is that?
Yeah, just one thing, just before I go to the IP, is we are talking about, first of all, was the issue of the internationalization of research.
Yes.
Research is actually is not a one country thing, it's global. When a researcher is working in KEMRI, the same particular problem is working in KEMRI. It's also occurring in Tanzania, it's occurring in Cuba, or it's occurring in the US. So you get that we mostly work together as partners or networks. Again, when you get that there's an infection, infectious diseases, the infectious diseases they don't know borders. They don't need a visa. An infectious disease in Nairobi today, within a very short time, it is in London with the flights. It is in New York. So it's always an issue that we have always to work together as a team, as a global team on this. So when it comes to the issue right now, IP, is, yes, as we said, it is who funds you is the one who always has to be able to, has to say in your IP. We have been having a lot of problems in IP because of such, because where the money comes from. But we are now trying to claw back because it is a give and take. That particular person will not be able to come to you if there was something you are not able to give. So it's the give and take right now that is actually making us that, yes, you gave us the money, but we have the specimens, we have the patients, we have the samples. So we have to have exploit or to be share the IP.
Right.
So IP has been a big issue, but we are now trying to be able to make sure that we are at a good negotiation in that it is shared IP.
Okay.
Yes.
So, I mean, you know, oftentimes, folks who work in communications, we say some of the people who don't talk about what they do enough are medical practitioners.
Yes.
In terms of research and the work that has been done over the years, you don't talk about it enough. Again, I'm going to go back to when we went to Kilifi, I'm sure CT, you remember, and the work that's being done with malaria, for example. And I'm making a connection to this because if we know regularly what is actually happening as a result of the research that's being done, then it is clear that you make a case for how it must be supported, not should be or suggestion or maybe, no, how it must be supported. So when we look at the work, for example, that is being done with malaria in certain counties in this country as a result of the research that KEMRI is doing, and we look at babies' lives, and we went to the natal unit that treats malaria, and we see the life-saving work that is done as a result of research in particular counties, then you're able to make the connection and you say, hang on a minute, as a result of this, lives have been saved. As a result of this, a particular medication, right, has then been found, has been created. The lives of children have been saved. We've studied the tsetse fly, for example. We know that this is what it does and this is how it affects human life. And then as a result of that, we know that this is what we can treat. These are things that are happening here in Kenya. These are lives of Kenyans that are being saved. These are children that are being treated and they get back to normal life right here.
Yes.
But we don't see it every day, but it's happening every minute. So how do you then make that absorption of this research that is being done, not even at government level, but with the lives of Kenyans known? And something that's in the open then becomes a very clear and present reality. And we say, we have no choice but to support this thing. No choice. How do you do that? Take it from the operation to now the glaring reality to people that it's KEMRI that's behind this.
Yeah, I think we do. You have said the correct thing. One thing is actually the issue of communication. Communication is very, very key. And communication, we need to up our communication. And it is actually good that through such fora, we can be able to say what we do. And then people can see the impact of what we do, the impact of the lives that we save by research. So I would say that the thing is to strengthen our communication, work with the communicators, not only in terms of particular papers that we publish and put them in journals, not only in terms of conference that we go and present, but also making people know that this has come out of research. The moment that we have people know that this is coming out of research, that life has saved of research, this new drug has come out of research, and this number of children have been saved from malaria because of research, then we should be able to actually have a good way. So the thing is actually to up our communication, I think so. Yes.
You know, for instance, in the field of HIV and AIDS, which is the field I worked in for the longest time, and I still do, see, it isn't known, for instance, that part of Suba County, Homa Bay County, there's a sub-county that we refer to as Suba. And within Suba, there are islands. There's an island called Remba. Because of the work that KEMRI did in research and then care and treatment in that region, KEMRI actually built a clinic on Remba Island. It never had one. That is the work of that and the partners. KEMRI built staff houses for members. How did we look after patients on that island then? We used a bar because people tend to go to a bar at night.
Yes.
So 2 or 3 times in a week, we would go to this bar because in the morning there are no people, and you would see patients up to around 2 or 3 o'clock, and then you'd leave. But the island
in the bar.
Yeah, yes,
okay, fine.
yes. It's a bar.
This is why CT worked there for a long time.
So, it is also not known that because of the partnerships that KEMRI had in the HIV and AIDS work, everywhere they worked, whether it was in Kisumu County, whether it's in Homa Bay, whether it's in Migori, they built comprehensive care centers. Built. Okay. People see it and they take it for granted. But I'm talking about what KEMRI did and the partnerships. Researchers don't talk loudly enough about the work they do, the life-saving work. In HIV and AIDS care and treatment, there's something appropriately called test and treat, where you test someone, the HIV positive, you put them on treatment. It wasn't always the case.
No.
There was a research that was done in Kenya by KEMRI and its partners. It was called Sustainable East African Research on Community Health, SEARCH. Part of it was in Mbarara in Western Uganda. It is that research that informed the test and treat. Without that research, we would not have had the evidence that then supported the idea when you test somebody, you treat them immediately. Now, I'm simply giving this as an example. Now, this is just HIV. There are 15 centers, and all these centers have a specific area of health that they relate to. Now, can you imagine just the impact that that makes on a nation? And this research is not just consumed in Kenya, it is consumed throughout the world.
International.
Yeah. And it's very critical. In fact, if you just look at the international impact of centers such as KEMRI. In fact, let's look at the region. If KEMRI stops functioning, how much capacity will be taken out of Uganda, Tanzania, etc.? Because these guys actually come and count on Kenya to do this research.
Yes, East and Central.
Exactly.
Yes.
Exactly. So your job is quite important. There's something you said that I think is dear to my heart. You know, I am really tired of this country where rich people only contribute to churches, and then if they're contributing, maybe they give you a lift in their Range Rover.
Okay.
You said that Kenyans need to put their money where it matters. How can someone contribute to KEMRI? I think that's a critical question. So that they stop building malls and houses in Karen they don't live in, and actually save lives and perhaps be useful members of society.
Yeah, I like that. The thing is that we are engineering our way right now, as you say, Chache, of how we can be able to get our funding. And this is a new gospel that we are trying to preach to Kenyans, that please support us so that we can be able to do this particular impactful research that can be able to save lives. We are going towards an area of getting a foundation so that we can be able to get this instead of us depending on this particular external funding to be able to get these funds. So, yes, that is an area that really we are urging Kenyans that look what we are doing. See if what you are doing really has an impact on you. It has an impact not only on you, on your neighbors. Support us, yes, so that you can be able to get to do the themes that are close to us. Yes, so that's not what we think that should be able to really push it towards that direction.
Please, when you do, you have a website, a number of people can call. Please let us know. I think this is something that is critical to the heart of Kenyans, because we need to own our safety. We need to own our healthcare system, and we can actually do something to help.
You know, Mark, most of the help that we get and the funding we get, these endowments or the foundations, aside from that, it's taxpayers' money from this country that actually helps with this research.
Yes.
See, but it has to be purposed. See, but it can't be purposed if it's not understood. It has to be understood.
That's great, because, as you say that, it has to be understood. And so then we get to the place when we say name them. So, Prof, I think it's important that when we're talking about some of the work that actually has been done, take us through some of those. What is some of the work that has been done that we can see as a result of this research? We've been able to see that we've reached this milestone, we've crossed, so that one is no longer is a thing of the past, that we don't have to search for malaria drugs anymore, and that has come as a result of the research that KEMRI has done. So walk us through some of those things, 2 or 3 of them that we can see.
Let me just walk on you on one. Number one is that what has come out of KEMRI. First, let's look at malaria, as you are talking about. there is the vaccine for malaria at GSS. That vaccine has actually now being used for kids, and it was because of the work done in KEMRI. The RTSS malaria vaccine, that's number one. Number two is a vaccine for human papillomavirus. We worked for cervical cancer. Through the work of KEMRI, we could be able to show that this particular vaccine doesn't need to be given 3 times, can only be given once. In that way, it was saving issues of money. It was issues of time for us to be able to have the efficacy of that particular vaccine. When you come to other issues of tuberculosis, we have work currently going on the vaccine for tuberculosis, which it has taken some time. The tuberculosis vaccine that you have been using in this country has been nearly 100 years ago. There has been no change of that vaccine. And that vaccine has actually, the impact of that vaccine right now is waning because of particular new things of resistance. And in that way, we have to be able to really try a new way of doing vaccine. So there's a new vaccine right now on TB that we are actually carrying out clinical trials on. And we think this will be a game changer in terms of the many loss of lives that we have been having on TB. So that is one of the impacts on the areas of actions. When we come to the areas of testing, the issue that when there is an outbreak of a disease in this country, Ebola, Marburg, you have even Mpox, the first people that are on site to be able to really get that particulars, to know what it is KEMRI. We pick that, we come and test it and inform the country that this is this particular pathogen. And with that, you can be able right now to determine or to do control or preventive measures around that. That is one area that we could say that is our forte in terms of emerging or emerging infections. When it comes also to terms of kits, say diagnostic kits, we actually have products that you could be able to use for the testing of these particular kits. When we come to the other day, we had my staff here was talking about the DNA testing. We are actually working on the area right now on genomics. Genomics is a big area that we KEMRI are entering into. And in that, in what is called precision medicine, whereby there is going to be targeted treatment based on the genetic composition of the body, of our population. When we get drugs from outside the country, usually they have done trials in those particular countries, and the genetic makeup is different from ours. So we have really been finding that we need to be able to build our own genetic library or our genetic repertoire, whereby you could be able to use to develop our own medicines or develop what's called precision and targeted medicines. So that's an area that we are now actually working on. When you come to the area of UHC currently, KEMRI is in the forefront. When we did a study and find out that for the UHC, the best people to use for UHC for it to be succeed is community health promoters. But then we found that the community health promoters themselves, they were not empowered. They were not even being paid. That these are the particular people, when they go to the households, these were the key people for the primary health care. So based on the findings from KEMRI, right now that particular team has come up and is now at the basis of the primary health care, getting 100 households and so on. The other day, we also got into the aspect of doing what is called monitoring and evaluation. To monitor and evaluation UHC, to monitor and evaluate SHA. So we are working on evaluation because of this particular issue right now that it is not working. There are issues, there are challenges in it. They say, okay, we need data. We have to have data on it for us to be able to really to show that this is the way it should go. This is the challenge is here, and this is how it can be corrected. So we are currently working on that as an area for SHA or UHC to be able to get the data which can be able to help in terms of giving it the right direction. We are also having various other research. I could not just say it, as Munga has just said, areas of HIV. The change of the treatment that we have been giving in HIV in this country is because of the work of KEMRI. We managed to change when we had ARVs. the ARVs moving from one type of ARV to the other one because of the resistance and because it was not working, has been because of KEMRI's managing to come out that particular information by the particular clinical trials you have been doing. So, seeing the area of what is called antimicrobial resistance, we have a lot of drugs right now we are using for bacterial infections. But here is a situation whereby we are seeing a lot of those particular drugs now are resistant. So we are in KEMRI right now monitoring to be able to advise the country that there is what is called antimicrobial resistance on the drugs that you are using, so that they can be able to really target it and say, no, this one works.
So if I can just draw, I mean, because a lot of times we listen to this and we hear, okay, so what does that mean? So essentially, when a parent has taken their child to hospital, for example, and been, diagnosed with bacterial infection, for example, right?
Yeah.
They're given an antibiotic.
Yes.
They go, 5 days, 7 days, whatever the case may be. They heal, they come back. In the future, if you're infected again and you come back and you take and you're prescribed an antibiotic again, what we're saying now is that we've gotten to the place where a lot of this medication, then you will take the medication, but you will then essentially relapse after some time, or you will not get well and you have to keep taking. So your body essentially is resisting that medication because of certain environmental factors. And what now KEMRI needs to do is step in and either, raise the fence, essentially, with that research to make sure now that you have drugs that are in the market that will be able to counter that resistance.
Yes. First of all, it's not the body itself that managed to become resistant. It is the pathogen itself. It's the bacteria.
The bacteria, yeah.
Yeah, because on the bacteria, it depends also how the usage. Yeah. Because the moment you expose a bacteria to a low amount of that drug, it easily gets resistant. Again, is the dosage.
Yes.
And you go to the pharmacy, you get what's it called, over the counter.
Oh, yes.
Somebody uses it, and then it's not the right type. And you might have used a wrong one, which actually makes that particular pathogen or that particular bacteria now resistant
to it.
So, what we are doing in KEMRI is to be able to actually advise that this is not the right drug you can currently use in this country. This one is obsolete because majority of the bacteria in this country, which we are using for the treatment of children, let's say right now in the neonatal, cannot be able to work. So this may be the right one. But as we are moving on, we are getting that the numbers are becoming lesser and lesser.
Less, yeah.
Because that particular numbers, the spectrum of the antibiotics, there has been so much misuse. You can know also, even in chicken.
Yes,
they are being used in
livestock, chicken. Yes.
They are used in livestock. So that has increased that particular spectrum of resistance. And what we are doing in KEMRI, not only in terms of surveillance, not only in terms of advising, but also trying to find out right now among these which could be the one which is working, so they can be able to advise the country.
And that surveillance readily available right here in Kenya with Kenya's research scientists, with Kenya's own people to ensure that, we have a balance of these things. So there's a case to be made for this support. There's a case to be made to understand that this is not a foreign thing. It is right here in Kenya and can actually be done here, isn't it, Prof?
That's it. That's it.
That is exactly what's happening.
Yes.
There is definitely a case to be made for, putting a lot of, support behind funding of medical research. But aside from that, even the acknowledgement that such groundbreaking stuff is happening right here within the borders of this country, and to be able to say that, yes, we realize that. And so we thank you for coming in today to help us to understand and to really look into some of these things. It's important that we continue to have these conversations and highlight these things as we go along. So we want to thank you, Prof, for being here this morning with us.
Thank you, Udu. Just before you conclude, just want to also pass the message that every year we do have a conference, which we get all our scientists to come together and we can be able to present their findings.
Yeah.
We are having this particular conference for this year from 11th to 14th of this month. At Safari Park Hotel. Our young scientists come and they can be able to do their presentations. We have our partners also coming in. So we'll urge you have a big number of presentations, I think around 300 this year. As you have been moving along, this is around 15 years.
Yes.
It has been actually been increasing the numbers of So this will ask the Kenyans to be able to listen to us and get their new findings of what we are actually doing in KEMRI.
Yeah.
Because that is a jamboree that you always have to become the impact of what you have been doing.
Indeed.
So that's what I just wanted to say.
Asante.
The other thing is also that in KEMRI we also have a graduate school. This graduate school we train masters and PhD students.
Yeah.
Because of the next team of scientists that we have to make in this country.
Are coming from there.
We are coming from there. So we'll urge the Kenyans who are especially qualified to be able to get into a graduate school, because that's where we are really getting the next
stock from.
Yeah, of our next team.
Asante Sana.
Thank you very much, Oda.
Professor Elijah Songoke is the Acting Director General of KEMRI, has been our guest this hour. Good morning. It's 9:01.